today?
I'm doing well. How are you?
I'm doing well as well, thank you. All right, so today we're going to go and go over the report of findings from your previous visit, and we're also going to go and go over the informed consent. Do you have anything to add or any concerns that you have?
No, ma'am.
Do you have it? Okay. All right. So based on the results, based on like all the questions, all the exams that we did on your first visit, that neck pain that you feel and it goes down your neck, it's something that is called cervical radiculopathy. And so what this means is that there's a pinched nerve or there's an inflamed nerve that's causing that neck pain, and it's causing that weakness on that deltoid right here on that left arm, and those uncomfortable feelings that are traveling down that left side. And because of that, you are noticing that weakness and that decrease of range of motion. And so, what that means is that when you're doing that flexion, like just going side to side, you feel kind of stuck. You feel like you can't go fully all the way. That's one of the symptoms of cervical radiculopathy. And so luckily with chiropractic adjustments and exercises, the condition is expected to fully recover in functional improvement. But overall, it's not going to go ahead and fully recover, and that's because there's a limiting factor, and that is degenerative joint disease, and that's located on your C4, C5. What this means, it's a type of arthritis. It's not inflammatory, but it is the limiting factor in your full recovery for this. And so when we did those testing, when you were going up and down on your head, bringing it side to side, and you noticed you couldn't go all the way, this is one of the reasons. It's very common, mainly in males in ages 45 and up. It is a progressive disease, but with chiropractic care, we can go ahead and help with those uncomfortable symptoms. Do you have any questions so far?
No, ma'am.
No? Okay. So I do want you to be aware that degenerative joint disease is not a contraindication to spinal manipulation. So what this means is that we can go ahead and help you. I can go ahead and help you today in the office, okay? And just so you get a better idea of what I know I mentioned C4, C5, that's where it's located, disc um, disease. And so this little spine right here, so all it's saying is around this area, that's where the issue is. I don't know if you can see this yellow little thing sticking out. So these are the nerves, and around this area, it's getting pinched, and it's causing those uncomfortable feelings.
All right.
Okay, so you have expressed to me that driving, sleeping, and taking care of yourself without any pain are very important to you, and those are some of your main goals, as well
Yes.
as lifting weights without causing any extra pain. So I made a list of goals that are going to go and help you get there. I'm going to go ahead and see you for the next 4 weeks, 3 times a week. And what we're going to go ahead and do, we're going to start by increasing that range of motion, and chiropractic care is going to help with that. We're also going to go and increase your strength, especially on that left deltoid. And we're going to increase your cervical endurance for that neck flexors. I don't know if you remember that one is when you were laying down and I asked you to go ahead and bring your whole neck and head up and hold it without shaking. And so you were able to hold for about 20 seconds. So I have a little goal for you, and you're gonna go ahead and hold that for about 30 seconds in the span of the 4 weeks. How does that sound?
Sounds great.
That sounds great. Okay, perfect. And so with all of this, you're gonna go ahead and see a decrease in pain when you're driving, when you're sleeping, when you're taking care of yourself. And even if you're not lifting weights at the gym, if you're just lifting something heavy at home, you're not gonna add that extra pain, okay?
Okay.
All right, in addition to all of that, I'm gonna go and show you Mackenzie's cervical retraction exercise, and you're gonna go and do this at home 3 times per day. And so what you're gonna go ahead and do, pretend somebody ugly is gonna kiss you, and you just say no. So you wanna go and give yourself that double chin. And you're gonna go ahead and do that about 3 times per day. You're gonna go and hold for about 10 seconds, then 2 seconds off. So you're gonna go ahead and relax for 2 seconds, and then do it again for 10 seconds. You can do this when you're driving. You can do this when you're sitting down somewhere. You can go ahead and do it wherever it is that you want. All right. Do you have any questions regarding that?
No, ma'am.
No? Okay. All right. So I'm going to go and give you the informed consent, and we're going to go ahead and go over that real quick. That way you can go ahead and ask me any questions if something doesn't sound right, or I'm going to give you the details as to what chiropractic adjustment is. You can go ahead and let me know if it's something that you would like to continue or if you want to look at your other options, okay?
Okay.
All right, so starting from the top, if I can just have your name, and so we're gonna go ahead and go to the nature of chiropractic adjustment. And so the word chiropractic, it means done by hand. So we're not gonna penetrate the skin. We're gonna go ahead and do everything with our hands, and we do have some tools that can help you out. And if that's necessary, we can go ahead and go over that in the future. With chiropractic adjustments, you might hear a pop, a clicking, and so that's normal. That's normal, but keep in mind if you don't hear that pop or clicking, it doesn't mean that nothing moved. You're still gonna feel a sense of movement. Going down to the material risk inherited in chiropractic adjustments, as any other health profession, there is some side effects. Some of the side effects are fractures, dislocation, disc injury, muscle strain. You might feel stiffness or soreness. And just so you know, like moving down to the probability of the risk, a lot of them are very rare. So like the fracture and dislocation are very rare. Um, it's usually if there's something underlying, for example, bone weakness, but based on on the testing, based on the history that we did together, I doubt that any of that is going to happen, the fracture and the dislocation. You might, however, feel soreness afterwards or stiffness, and that is normal. Okay, and we're gonna go and move down to your other treatment options. So if you think about it, if you read everything and you say, oh, you know what, maybe chiropractic's not for me, that is okay. There are other options. You can go ahead and seek medical care from your primary care physician. You can also go ahead and self-medicate. You can use medicine that's over the counter, something that's anti-inflammatory, muscle relaxants, anything like that. Just keep in mind to know that there's other risks and benefits associated with each of these options, and you might want to go ahead and talk to your primary care physician if you do pick up a prescribed drug or just something over the counter. Other options are surgery or hospitalization, but I doubt you need any of that. I really do think we can go ahead and help you with just chiropractic adjustments and exercises. And within those 4 weeks, we can go ahead and see how much progress you have made. Lastly, the risk and dangers of choosing to remain untreated. It can further reduce mobility so that the generation that you have on your C4, C5, that is progressive, so that is going to go and get progressively worse. But with exercise and chiropractic care, you can reduce those symptoms. And just the more you decide on taking action on what you're feeling right now, the longer it might take for you to feel better. Does that make sense?
Yes.
Okay, so right here at the bottom with the big red letters, I'm gonna have you sign, and please just go ahead and take your time, read it over, and when you're ready, go ahead and read it and sign it, and you can go ahead and give it back to me. And lastly, do you have any questions that I could answer for you about the informed consent or about any of the treatment that we're gonna go ahead and do?
No.
No? Okay. In that case, we're gonna go ahead and get started, okay?
Okay.